Hi, good morning. I'm going to demonstrate something about beauty and balance. We have an attractive young woman here. She's here to get lip injections. When I examine her, when I evaluate her, she has a beautiful bottom lip. So it's about balance. Some people like the bottom lip to be fuller, some people like the top lip to be fuller. I personally like them to be almost the same size, but it depends on the face, depends on ethnicity, depends on age, sex. A lot of things have to go into play. Now, a little bit of an imbalance is okay, but in her situation, the top lip definitely could use more volume, and that's what we're going to do. I'm going to use Restylane for her for the top lip. We could use Juvederm, we could use Volbella, but Restylane gives you the biggest bang for the buck. It's 0.5 cc's and it gives the best shape. Volbella is a little bit too soft in this situation, and Juvederm Ultra comes in 0.4 cc's, so I don't have enough material as I need. So I'm going to demonstrate that technique here with Restylane. So she has had topical numbing placed. There's no dental block. It's very tolerable. It's not pain-free, but it's very tolerable. Poke. Is it okay?
Yeah.
Not terrible?
Okay.
You can put your lips together. If you penetrate really slowly, it hurts less. When you jab and stab, that's when it hurts more. Just watch how slow the needle's going through. Taking my time. There's no pressure. Pressure sets off certain nerve endings. So the nerve endings that pick up sharp are different than the nerve endings that pick up pressure. And you don't want to set both off. Now, the Restylane does have 0.3% lidocaine in it. So as we go through it, it gets more and more comfortable. But again, you see the technique. Be gentle. When you're gentle, you get less bleeding, less swelling, less bruising. I'm watching it shape right in front of my eyes, watching the filler go. The central part of her top lip is fuller. I'm not going to do much there. You don't want to inject everything uniformly, because then it's going to look like a uniform sausage. We don't want that. I'm going to switch sides. Camera angle is perfectly fine where it is. Another little poke. Real gentle. Tiny needle. It's very bearable. 10-15 years ago, we used to do dental blocks and numb people's entire midface. In the last probably 5 to 7 years, I can't remember how many dental blocks I've done, maybe just a handful. It's not necessary. With good topical numbing and good technique, it's very tolerable. But people come in and say, you know, they had injections, it was brutal, they were in so much pain. Well, either no topical numbing was used, or it was a jab and stab technique. You doing okay?
Yes.
Have you been forced to say yes?
No.
All right. It's a voluntary yes. This patient's driven from quite a far away to come here just to have this little bit of discomfort. Put lips together. More balanced. I'm going to do a little bit more in this zone. Going at a different direction now. She does have a good vermilion border. I don't need to do there. My massage for lips is this. That's it. When I do this, it smooths everything out. Again, I have heard from patients where they've gone and injections were done, and then the doctor spent quite a bit of time just wrestling the lips, massaging and massaging and massaging. That's not necessary if you do the micro-droplet, when you put tiny little droplets in different places. The beauty of that is you don't feel lumps and bumps. And the other beauty is it lasts longer. because the wrestling goes into different levels. Put your lips together. More balanced. How are you feeling?
Good.
Good. Smile really big. Now whistle. Very symmetric. We'll do a little bit to the top now. We'll switch. I'm going to do a little bit more pouty. If you go pouty, it's a little bit more central. But again, you see it was 0.5 cc's. And I don't know if anybody's keeping count of how many times I've poked her with 0.5 cc's. But that's a true micro droplet. Very little bleeding. No bruises. She can go out right afterwards. I tell my patients don't go to lunch because your lip is numb. You're going to drool over yourself. But you can go out and she'll look normal. Tomorrow morning it is more swollen. There's a tiny little bleeder like that, no big deal. Just hold a little pressure and it stops. These are tiny little capillaries. And that's it. Now when you hold pressure, I've seen people kind of dab and dab. Just hold pressure. You gotta hold pressure. You hold pressure for 15, 20 seconds, it'll stop the bleeding. Now, things that make you bleed and bruise more. Nuts, walnuts and almonds, seeds, flax seeds and chia seeds, tahini, sesame seeds, fish oil, avocados, even vitamin D that's fish-based. All of that has a lot of omega-3s. So those patients you'll see, you have to hold pressure for 45 seconds. Normally bleeding time is about 25 seconds. When you poke somebody, you should stop bleeding in 25. But people that eat a very healthy diet, the Mediterranean diet, you'll see, they will bleed more. Just hold a little bit more pressure. And that's essentially it. Stops bleeding. Every bleeder stops, and we're done. So that's basically a micro droplet technique, wrestling to the top lip. Thank you.